cancer may often never get any kind of kidney issues and stuff. That's why we have to give the MELD exception score for cancers.
So you're saying that, I'm sorry to interrupt you, NASH is non-alcoholic fatty and fatty liver.
Yeah.
That also more affects the kidneys than PSC?
It can do. PSC and PBC can, but less commonly we see issues with ascites. We see issues with bleeding varices for sure with patients with PBC and PSC, but less issues with kidney impairment. It certainly can occur. It would be wrong for me to say it never occurs, but it's less common than with the NASH patients.
So then, if half the MELD score, why is half the MELD score kidney based?
Because if you get kidney failure associated with cirrhosis, that's usually bad. It's a high mortality.
Okay.
So.
But what about if you don't get kidney failure? You can just live with cirrhosis forever?
Not forever, but for a longer period of time than if you have kidney failure. When MELD score was first identified, it was actually developed in Rochester by Ray Kim and Pat Cammett and various issues. They went through a whole ton of things and they looked at various issues and stuff. And when they did the math high complex things that came up, these were the variables which gave the best, most useful predictor. But they always recognized it had its limitations. It's not perfect. And now I'm just going through, because I'm just checking here which you're listed. So right now you're listed to accept hepatitis C positive organ. You're not accepting hepatitis B core positive graft, which I don't quite understand why you wouldn't accept that.
What's that mean?
So that means you get an organ that may or may not have been exposed to hepatitis B in the past. Sometimes that test can be falsely positive, and the organ may not have been exposed to hepatitis B. If you accept a hepatitis B core positive donor, we would give you hepatitis B therapy for a year, and then give you the hepatitis B vaccine and see if we can get you off the hepatitis B therapy thereafter. There's a possibility that if you accepted a hepatitis B core positive donor, that you may, if you're not on treatment for hepatitis B, the hepatitis B could become an issue after transplantation.
But can you treat it? Is the question?
Yes.
100%.
One pill a day.
Fucking get B core.
And
then you mentioned something about, go ahead.
The other is a DCD liver. Now,
DCD liver.
Have not, you're listed here as not accepting a DCD organ, and in general we have avoided DCD organs in patients with PSC.
Why?
Well, one of the issues comes up is if there are bile duct changes down the line after the transplant, is it because you received a DCD organ or could be from recurrent PSC? Now, classically, if you get bile duct damage within the first 3 months after the transplant, we usually put that down to accepting the DCD organ, because the DCD organs have about a 5% chance to get this thing called ischemic cholangiopathy, which is like PSC, scarring the bile ducts, which can cause problems and cause cholangitis, even failure of the liver. Now, we've had success in our center in using those organs. Some centers haven't. And some centers report rates of ischemic cholangiopathy of 15-20%. Our ischemic cholangiopathy rate is less than 5%. But we have been concerned about using DCD organs in patients with PSC because of the bile duct issues.
No DCD.
About 10 or 15% of our organs we utilize are DCD organs. 10 or 15%.
Well, but you just said it wouldn't be good for people.
So
would you recommend that?
Well, I'm just putting it out there. Ultimately, I'm not you, so I can't. I'm just explaining the rationale why we've been hesitant to use DCD organs for patients with PSC. But I certainly don't see we should if you're the core positive, definitely you should, in my opinion, you should be accepting core positive organs.
Great.
So.
Well, will that expand it a little bit?
It'll expand a bit, yeah. So
okay.
I'll communicate to whoever's in procurement that you'll accept hepatitis B core positive.
Yes. I would rather do that. DCD doesn't sound
Now,
good.
you mentioned something about 70-year-old.
Oh, 70-year-old people. Yeah, we're the age.
Yeah, we don't. I mean, we'll look at older organs, and if potentially if an older organ comes, and it might be the right size of blood type, and we can't find a suitable other person, then we've used organs in the 80s, and I'm not sure we used in the 90s, but we certainly 80s, and sometimes we've a little bit of leeway in terms of who that organ might go to.
We have the test result. The creatinine went up to 1.06.
Yeah,
is that good? Is that?
Well, yeah, it's
marginally higher, so I'm not sure.
Does it give you a point? What about the bilirubin?
The MELD score.
What's the MELD score now? It's 137 for the sodium. And then, let me see.
Can I just feed him a lot of salt?
Yeah.
That wouldn't help.
Oh.
You just get swollen.
So seriously, what you eat, does that affect it?
No, not really.
Oh.
No, it may, well, if you eat lots of salt, you get swollen.
No, but as far as the
The
bilirubin.
score is 19 today, based on.
Hell yes, that's better
Ni-
than 18.
19 is based on the numbers, so
Well, I hope 18 was not reported.
no, we can submit 19 now, so that's all right.
Okay.
Okay.
Well, that's, and if you get 3 points, you never know.
Mhm.
20, 21, 22.
Yeah.
I'll live with that.
Hmm.
You never know.
Okay.
Thank you. If you don't try, you can't buy.
That's right.
So
So.
it just went up.